Bronchial asthma. Asthma is a chronic, or lifelong, disease that can be serious, even life-threatening. There is no cure for asthma. The good news is that with proper management, you or your loved one with asthma can live a normal, healthy life. What is bronchial asthma? The airways are tubes that carry air in and out of your lungs. Asthma is a chronic lung disease that makes it harder to move air in and out of your lungs. If you have asthma, the airways can become inflamed and narrowed at times. How asthma affects your body. With asthma, swollen airways become extra sensitive to some things that you are exposed to in the environment every day or asthma triggers. When you breathe in a trigger, your airways create extra mucus and swell even more, making it hard to breathe. Do I have severe asthma? When your asthma is well controlled, you experience very few symptoms throughout the day and night. You can perform daily activities without shortness of breath, chest tightness, coughing or wheezing. Some people have asthma that is difficult to treat or does not respond well to inhaled corticosteroids. Depending on the type of asthma that you have, there are different management steps and treatment options that can help. How serious is asthma? There is no cure for asthma, but the good news is that it can be managed and treated, allowing you to live a normal, healthy life. Asthma affects people of all ages and often starts during childhood. You may wheeze, cough, or feel tightness in your chest. These symptoms can range from mild to severe and can happen every day or only once in a while. Certain things can set off or worsen asthma symptoms, such as cold air. These are called asthma triggers. When symptoms get worse, it is called an asthma attack. What is an asthma attack? When you breathe normally, muscles around your airways are relaxed, letting air move easily and quietly. During an asthma attack, three things can happen. Bronchospasm, the muscles around the airways constrict, tighten. When they tighten, it makes your airways narrow. Air cannot flow freely through constricted airways. Inflammation, the lining of your airways becomes swollen. Swollen airways don't let as much air in or out of your lungs. Mucus production, during the attack, your body creates more mucus. This thick mucus clogs airways. When your airways get tighter, you make a sound called wheezing when you breathe, a noise your airways make when you breathe out. You might also hear an asthma attack called an exacerbation or a flare-up. It's the term for when your asthma isn't controlled. What types of asthma are there? Asthma is broken down into types based on the cause and the severity of symptoms. Doctors identify asthma as intermittent. This type of asthma comes and goes so you can feel normal in between asthma flares. Persistent. Persistent asthma means you have symptoms much of the time. Symptoms can be mild, moderate or severe. Doctors base asthma severity on how often you have symptoms. How is asthma classified? Doctors rank how bad asthma is by its symptoms. 1. Mild intermittent asthma, mild symptoms less than twice a week. Nighttime symptoms less than twice a month. Few asthma attacks. 2. Mild persistent asthma, symptoms 3 to 6 times a week. Nighttime symptoms 3 to 4 times a month. Asthma attacks might affect activities. 3. Moderate persistent asthma, daily asthma symptoms. Nighttime attacks 5 or more times a month. Symptoms may affect activities. 4. Severe persistent asthma, ongoing symptoms both day and night. You have to limit your activities. Types of asthma. There are several. Adult onset asthma. Asthma can start at any age, but it's more common in people younger than 40. Status asthmaticus. These long-lasting asthma attacks don't go away when you use bronchodilators. They're a medical emergency that needs treatment right away. Asthma in children. Symptoms can vary from episode to episode in the same child. Watch for problems like coughing often, especially during play, at night, or while laughing. This may be the only symptom. Less energy or pausing to catch their breath while they play. Fast or shallow breathing, saying their chest hurts or feels tight. A whistling sound when they breathe in or out, seesaw motions in their chest because of trouble breathing. Shortness of breath, tight neck and chest muscles, weakness or fatigue. Exercise-induced bronchoconstriction. You might hear this called exercise-induced asthma. It happens during physical activity, when you breathe in air that's drier than what's in your body, and your airways narrow. It can affect people who don't have asthma, too. You'll notice symptoms within a few minutes after you start to exercise, and they might last 10 to 15 minutes after you stop. Allergic asthma. Things that trigger allergies, like dust, pollen and pet dander, can also cause asthma attacks. Non-allergic asthma. This type flares in extreme weather. It could be the heat of summer or the cold of winter. It could also show up when you're stressed or have a cold. Occupational asthma. This usually affects people who work around chemical fumes, dust, or other irritating things in the air. Eosinophilic asthma. This severe form is marked by high levels of white blood cells called eosinophils. It usually affects adults between 35 and 50 years old. Nocturnal asthma. Your asthma symptoms get worse at night. Aspirin-induced asthma. You have asthma symptoms when you take aspirin, along with a runny nose, sneezing, sinus pressure, and a cough. Cough variant asthma. Unlike with other types, the only symptom of this kind of asthma is a long-term cough. Asthma causes and triggers. When you have asthma, your airways react to things in the world around you. Doctors call these asthma triggers. They might cause symptoms or make them worse. Common asthma triggers include air pollution. Many things outside can cause an asthma attack. Air pollution includes factory emissions, car exhaust, wildfire smoke and more. Dust mites. You can't see these bugs, but they are in our homes. If you have a dust mite allergy, this can cause an asthma attack. Exercise. For some people, exercising can cause an attack. Mold. Damp places can spawn mold, which can cause problems if you have asthma. You don't even have to be allergic to mold to have an attack. Pests. Cockroaches, mice and other household pests can cause asthma attacks. Pets. Your pets can cause asthma attacks. If you're allergic to pet dander, dried skin flakes, breathing in the dander can irritate your airways. Tobacco smoke. If you or someone in your home smokes, you have a higher risk of developing asthma. You should never smoke in enclosed places like the car or home, and the best solution is to quit smoking. Strong chemicals or smells. These things can trigger attacks in some people. Certain occupational exposures. You can be exposed to many things at your job, including cleaning products, dust from flour or wood, or other chemicals. These can all be triggers if you have asthma. Infections like sinusitis, colds, and the flu. Allergens such as pollens, mold, pet dander, and dust mites. Irritants like strong odors from perfumes or cleaning solutions. Cold air or changes in the weather, such as temperature or humidity. Gastroesophageal reflux disease, GERD. Strong emotions such as anxiety, laughter, sadness, or stress. Medications such as aspirin. Food preservatives called sulfites, found in things like shrimp, pickles, beer and wine, dried fruits, and bottled lemon and lime juices. Asthma risk factors. Things that might make you more likely to have asthma include things in the world around you before you were born or while you're growing up. Whether your parents have asthma, especially your mother. Your race. Asthma is more common in people of African American or Puerto Rican descent. Your sex. Boys are more likely to have asthma than girls. In teens and adults, it's more common in females. Your job. Other conditions like lung infections, allergies, or obesity. Complications of bronchial asthma. Asthma complications include signs and symptoms that interfere with sleep, work and other activities. Sick days from work or school during asthma flare-ups. A permanent narrowing of the tubes that carry air to and from your lungs, bronchial tubes, which affects how well you can breathe. Emergency room visits and hospitalizations for severe asthma attacks. Side effects from long-term use of some medications used to stabilize severe asthma. Proper treatment makes a big difference in preventing both short-term and long-term complications caused by asthma. Prevention of bronchial asthma. While there's no way to prevent asthma, you and your doctor can design a step-by-step plan for living with your condition and preventing asthma attacks. Asthma is an ongoing condition that needs regular monitoring and treatment. Taking control of your treatment can make you feel more in control of your life. Get vaccinated for influenza and pneumonia. Staying current with vaccinations can prevent flu and pneumonia from triggering asthma flare-ups. Identify and avoid asthma triggers. A number of outdoor allergens and irritants, ranging from pollen and mold to cold air and air pollution, can trigger asthma attacks. Find out what causes or worsens your asthma, and take steps to avoid those triggers. Monitor your breathing. You may learn to recognize warning signs of an impending attack, such as slight coughing, wheezing or shortness of breath. But because your lung function may decrease before you notice any signs or symptoms, regularly measure and record your peak airflow with a home peak flow meter. A peak flow meter measures how hard you can breathe out. Your doctor can show you how to monitor your peak flow at home. Identify and treat attacks early. If you act quickly, you're less likely to have a severe attack. You also won't need as much medication to control your symptoms. When your peak flow measurements decrease and alert you to an oncoming attack, take your medication as instructed. Also, immediately stop any activity that may have triggered the attack. If your symptoms don't improve, get medical help as directed in your action plan. Take your medication as prescribed. Don't change your medications without first talking to your doctor, even if your asthma seems to be improving. It's a good idea to bring your medications with you to each doctor visit. Your doctor can make sure you're using your medications correctly and taking the right dose. Pay attention to increasing quick relief inhaler use. If you find yourself relying on your quick relief inhaler, such as albuterol, your asthma isn't under control. See your doctor about adjusting your treatment. Diagnosis of bronchial asthma. Physical exam of the patient. Your doctor will perform a physical exam to rule out other possible conditions, such as a respiratory infection or chronic obstructive pulmonary disease, COPD. Your doctor will also ask you questions about your signs and symptoms and about any other health problems. Tests to measure lung function. You may be given lung function tests to determine how much air moves in and out as you breathe. These tests may include spirometry. This test estimates the narrowing of your bronchial tubes by checking how much air you can exhale after a deep breath and how fast you can breathe out. Peak flow. A peak flow meter is a simple device that measures how hard you can breathe out. Lower than usual peak flow readings are a sign that your lungs may not be working as well and that your asthma may be getting worse. Your doctor will give you instructions on how to track and deal with low peak flow readings. Lung function tests often are done before and after taking a medication to open your airways called a bronchodilator, such as albuterol. If your lung function improves with use of a bronchodilator, it's likely you have asthma. Additional tests for asthma. Other tests to diagnose asthma include methacholine challenge. Methacholine is a known asthma trigger. When inhaled, it will cause your airways to narrow slightly. If you react to the methacholine, you likely have asthma. This test may be used even if your initial lung function test is normal. Imaging tests. A chest X-ray can help identify any structural abnormalities or diseases, such as infection, that can cause or aggravate breathing problems. Allergy testing. Allergy tests can be performed by a skin test or blood test. They tell you if you're allergic to pets, dust, mold or pollen. If allergy triggers are identified, your doctor may recommend allergy shots. Nitric oxide test. This test measures the amount of the gas nitric oxide in your breath. When your airways are inflamed, a sign of asthma, you may have higher than normal nitric oxide levels. This test isn't widely available. Sputum eosinophils. This test looks for certain white blood cells, eosinophils, in the mixture of saliva and mucus, sputum, you discharge during coughing. Eosinophils are present when symptoms develop and become visible when stained with a rose-colored dye. Provocative testing for exercise and cold-induced asthma. In these tests, your doctor measures your airway obstruction before and after you perform vigorous physical activity or take several breaths of cold air. Treatment for bronchial asthma. Prevention and long-term control are key to stopping asthma attacks before they start. Treatment usually involves learning to recognize your triggers, taking steps to avoid triggers and tracking your breathing to make sure your medications are keeping symptoms under control. In case of an asthma flare-up, you may need to use a quick relief inhaler. Medications for bronchial asthma. The right medications for you depend on a number of things: your age, symptoms, asthma triggers, and what works best to keep your asthma under control. Preventive, long-term control medications reduce the swelling, inflammation, in your airways that leads to symptoms. Bronchodilators. Quick relief inhalers, bronchodilators, quickly open swollen airways that are limiting breathing. In some cases, allergy medications are necessary. Long-term asthma control medications, generally taken daily, are the cornerstone of asthma treatment. These medications keep asthma under control on a day-to-day basis and make it less likely you'll have an asthma attack. Types of long-term control medications include inhaled corticosteroids. These medications include fluticasone propionate, budesonide, cyclosinide, beclomethasone, mometasone, and fluticasone furoate. You may need to use these medications for several days to weeks before they reach their maximum benefit. Unlike oral corticosteroids, inhaled corticosteroids have a relatively low risk of serious side effects. Leukotriene modifiers. These oral medications, including montelukast, zafirlukast, and xyludin, help relieve asthma symptoms. Montelukast has been linked to psychological reactions, such as agitation, aggression, hallucinations, depression, and suicidal thinking. Seek medical advice right away if you experience any of these reactions. Combination inhalers. These medications, such as fluticasone salmeterol, budesonide formoterol, mometasone, and fluticasone furoate bilanterol, contain a long-acting beta agonist along with a corticosteroid. Theophylline. Theophylline is a daily pill that helps keep the airways open by relaxing the muscles around the airways. It's not used as often as other asthma medications and requires regular blood tests. Quick relief, rescue. Medications are used as needed for rapid, short-term symptom relief during an asthma attack. They may also be used before exercise if your doctor recommends it. Types of quick relief medications include short-acting beta agonists. These inhaled, quick-relief bronchodilators act within minutes to rapidly ease symptoms during an asthma attack. They include albuterol and levobuterol. Short-acting beta agonists can be taken using a portable, handheld inhaler or a nebulizer, a machine that converts asthma medications to a fine mist. They're inhaled through a face mask or mouthpiece. Anticholinergic agents. Like other bronchodilators, ipratropium and tiotropium act quickly to immediately relax your airways, making it easier to breathe. They're mostly used for emphysema and chronic bronchitis, but can be used to treat asthma. Oral and intravenous corticosteroids. These medications, which include prednisone and methylprednisolone, relieve airway inflammation caused by severe asthma. They can cause serious side effects when used long-term, so these drugs are used only on a short-term basis to treat severe asthma symptoms. If you have an asthma flare-up, a quick relief inhaler can ease your symptoms right away. But you shouldn't need to use your quick relief inhaler very often if your long-term control medications are working properly. Inhalers. Keep a record of how many puffs you use each week. If you need to use your quick relief inhaler more often than your doctor recommends, see your doctor. You probably need to adjust your long-term control medication. Allergy medications may help if your asthma is triggered or worsened by allergies. These include allergy shots, immunotherapy. Over time, allergy shots gradually reduce your immune system reaction to specific allergens. You generally receive shots once a week for a few months, then once a month for a period of 3 to 5 years. Biologics. These medications, which include omalizumab, mepolizumab, dupilumab, rslizumab, and benralizumab, are specifically for people who have severe asthma. Bronchial thermoplasty. This treatment is used for severe asthma that doesn't improve with inhaled corticosteroids or other long-term asthma medications. It isn't widely available nor right for everyone. During bronchial thermoplasty, your doctor heats the insides of the airways and the lungs with an electrode. The heat reduces the smooth muscle inside the airways. This limits the ability of the airways to tighten, making breathing easier and possibly reducing asthma attacks. The therapy is generally done over 3 outpatient visits. Treat by severity for better control, a stepwise approach. Your treatment should be flexible and based on changes in your symptoms. Your doctor should ask about your symptoms at each visit. Based on your signs and symptoms, your doctor can adjust your treatment accordingly. For example, if your asthma is well controlled, your doctor may prescribe less medication. If your asthma isn't well controlled or is getting worse, your doctor may increase your medication and recommend more frequent visits. Asthma Action Plan. Work with your doctor to create an asthma action plan that outlines in writing when to take certain medications or when to increase or decrease the dose of your medications based on your symptoms. Also include a list of your triggers and the steps you need to take to avoid them. Your doctor may also recommend tracking your asthma symptoms or using a peak flow meter on a regular basis to monitor how well your treatment is controlling your asthma.